Retainers in FPD find it as the part of a fixed partial denture, which unites the abutment to the remainder of the restoration. A retainer is a crown or any restoration that is cemented to the abutment. Major retainers are retainers which cover the entire occluding surface of the tooth. For example, full veneer crowns, partial veneer crowns. Minor connectors are extensions that are cemented into the tooth. For example, only ill. So what is a retainer? It is that component of FUD which takes support from the abutment tooth and provides retention to the prosthesis. This is your FPD, that is fixed partial denture. It has three components. One is abutment, then your pontic, which is missing tooth, which we are replacing. Then your connector. Connector is, you can see here, this tooth is connected with this pontic through, that is connector, and this is your retainer. Right. So there are various requirements, various ideal requirements for the retainer. It should cause at least a least amount of destruction to the abutment. Should least destroys the outline form of the tooth. Internal lines should be finished with great accuracy so that we can prevent the abutment tooth from secondary caries. That means it should have easy burnishability, rigidity, withstand requisite loads. Functional adaptation and protection. Protect the tooth against its fracture. Least destroy the cervical marginal ridge. Position margins at least susceptible to caries or recurrence of caries. Preparation should be made without trauma to pulp or surrounding tissue. That covers in the biological consideration of your FPD. Accurate complement to the lost tooth structure. Easy cleansable and aesthetically pleasing. So retainers are of various types. They are basically classified into extracoronal and intracoronal retainers. And third one is radicular. Extracoronal retainer are complete crown, partial veneer crown. As I have already told you that these are basically all metals, all ceramic, metal ceramic. And in partial veneer, 3/4 crown, mesial half crown, 7/8 crown. Intracoronal retainers are inlay and onlay. Radicular retainers are cast post and fabricated post because they are going inside the pulpal system, radicular system. There are various criteria for selecting type of retainer. For full veneer crown, abutment teeth are aligned parallel to one another. Otherwise, there is change in path of insertion and removal. And there is sometimes locking of the crown. Partial veneer crowns, non-carious abutments with large restoration, but intact buccal and lingual surfaces. And all ceramic crowns. Classification of retainers based on tooth coverage, based on the location, based on mode of retention, and based on material being used. So based on the tooth coverage, full coverage retainers, partial coverage retainers, that means we can left some areas. Conservative retainers, like in case of this bridge, you can see we are taking half of the support, or we are taking only type of support from adjacent teeth. In case of full coverage retainer, these retainers cover all the 5 surfaces of the abutment. They are fabricated like cap and are usually indicated for extensively damaged teeth. So indication is mainly extensively damaged teeth. Right. And they are most retentive and ideal retainer because their design can resist masticatory forces in all the directions. Then come to your partial coverage retainers. They are preferred over full veneer crowns because they require less tooth reduction, but they are less retentive compared to full veneer crowns. Pins can be fabricated to fit pinholes created on Pins can be fabricated to fit pinholes created on the tooth for additional retention. So advantage are conservative tooth preparation, as we can save one side at least, guides for corneal contour, embrasure forms are pre-established, improved periodontal health as limited contact between margin of the gingiva. Marginal fit and complete sitting of casting can be easily verified before and during cementation. Margin accessibility for finishing and cleaning uncovered portion of tooth can be used for electric pulp testing and acceptable aesthetics. But there are some disadvantages also. They are not as retentive as complete coverage retainers. There is a limited display of metal. Tooth preparation is difficult because only limited adjustment can be made in the path of placement. And one very important disadvantage is the margins, the interface, the area where the tooth is making contact with the crown sometimes may lead to secondary caries. They are mainly indicated in intact or minimum restorative teeth, normal anatomic clinical crowns, teeth with adequate labiolingual thickness. Then come to your conservative retainer. They require minimal tooth reduction preparation. For example, acid etch. These dentures cannot accept heavy occlusal loads and are primarily indicated for anterior teeth. Right? They have small metallic extension which are designed to be luted directly onto the lingual surface of the abutment teeth using a resin cement. Require basically the more advantages require minimal tooth reduction, but there are various disadvantages also. Do not accept heavy load, have a small metallic extension. Telescopic retainers. These types of retainers is This type of retainer is used when the path of insertion of the fixed partial denture does not coincide with the long axis of the abutment tooth. The design involves the fabrication of two copings, one over the other. In the picture, you can see this is indicated mainly for the tilted abutment. Like this, these two teeth are in tilted position. Ultimately, we have to make the FPD that appears like the normal tooth. Like we have to cover the tilt of the abutment. Like this is the tilted abutment. Natural tooth preparation is, you can see like this. But ultimate outcome when we are inserting FPD over it, then it appears like a natural tooth. That means there must not be any tilt. So this is called telescopic crown. The internal and primary coping functions to modify the morphology of the tooth. Hence, the primary coping helps to change the path of insertion. Secondary coping is designed to fit over the primary coping along the new path of insertion. Accurate parallelism of coping is necessary. This is obtained by use of milling machine. Now come to based on the location, extracoronal, that is complete coverage or partial coverage, intracorneal, inlay, onlay, intraradicular, post, and core. So, inlay and onlay, that is mostly covered in case of intracoronal retainers. Inlay, it is defined as the restoration which has been constructed out of mouth from the goat. porcelain, or other metal, and then cemented into the prepared cavity of the tooth. This is most commonly used. It is essentially onlay is essentially an inlay that covers one or more cusps and adjoining occlusal surface of the tooth. It is retained by mechanical or adhesive means. Right. Then come to intra-radicular retainers. Radicular retained prosthesis consists of post or dowel with an attached core that obtains its retention and resistance to displacement from the prepared root portion of an endodontically treated teeth. Suppose this is an endodontically treated root, then this is your root canal system. In the root canal system, when we are completing the root canal, it is full of obturating material, that is a gutta-percha or any other kind of material with the sealer. But when we are placing dowel inside it, post inside it, then we have to remove the some part of gutta-percha, and then we have to place post through which we have to retain the core over it. Right. Then we have to take impression and your crown placement has been done accordingly. While the root preparation retains the post, the core establishes retention and resistance for the complete veneer crown. This is the core. It acts as a retainer and resistance for complete veneer crown that restore the pulpless tooth to normal form and function. The post or dowel and core may be custom cast, where the radicular retainer is fabricated to fit the root preparation, or prefabricated, where the root preparation is designed to fit a stock post and core is built up with silver amalgam or composite resin. This is called amalga post. Then there is a Richmond crown, which is a dowel retained crown made for an endodontically treated tooth using porcelain facing. Like we are placing a post and we have to make whole of the crown as a one unit, and we have to place it in the tooth. Detached post crown with a cast base. When the coronal portion of the remaining tooth is missing to a point below gingiva, it is impossible to adapt the crown and root face. A cast metal base is imposed between the base of the crown and the root face. This cast base is rigidly attached to the dowel. Based on the mode of retention encircling the tooth, full coverage crown, or called full jacket crown, mainly by grooves, we can give partial coverage, mainly by dowel pin, pin ledge, post in root canal, conservative restoration, resin bonded. Based on material being used, all metal retainer, non-metallic retainer, ceramic or acrylic, combined retainer, veneered, full veneered, metal ceramic, resin bonded, bridge retainer. Then come to factors affecting selection of retainer. First of all, amount of remaining tooth structure influence the retention properties of the retainer. Suppose if we have only the root portion, then we have to retain it accordingly, that we have to take all the retention from the radicular part. Teeth with extensive defective restorations or fracture may need intentional endodontic treatment on post and core, right? Crown lengthening when caries, restoration, or fracture are present. Like if we are getting a patient, patient is coming to you with a fracture below the fracture line below the gingiva, then we have to lengthen the crown by removing the gingiva from here with the help of scalpel or with the help of cautery. Crown morphology and quantity of sound enamel, dentine, resin bonded bridge needs intact enamel to be etched for micro retention.